Thanks for having me, and well done you guys for turning up on a Friday afternoon. At least you get a cake. As Marcus said, I've recently come over from Australia, completed my PhD there, which was all around mindfulness interventions for body image. So I thought it would be nice to rehash this a little bit for you guys. I'd like to talk about some of the studies that I've done over the course of my PhD, which I'd like to kind of continue on, I guess, over the next little while as well. So hopefully it is of interest to you. I probably should also mention as well that I'm clinically trained, so a lot of my research is more from a clinical point of view. So yeah, if you've got any questions at any point, just let me know. So I guess today what I'd like to do is give a bit of background to body image and eating disorder prevention. I understand that probably not all of you are familiar with this area. I'd like to then talk a little bit about what mindfulness is and how that might fit in with an intervention approach for body image, and then finish up with talking you through some of the empirical work that I've done throughout my PhD. So a good place to start, I guess, is at the beginning. And I guess when we're talking about body image, people have a lot of different ideas about what that might be. Basically, it kind of refers to how we think, feel and behave in relation to our bodies. So it's a very multi-dimensional construct, taking in elements from perceptual, cognitive, affective and behavioural areas. I guess it can be deemed both negative and positive, depending on the individual and their set of experiences. So when I talk about negative body image, I'm talking about kind of the negative perceptions and evaluations of the body and of the appearance. And this can be negative thoughts and feelings and behaviours that might have detrimental impact. It also often coincides with a problematic investment in body image kinds of problems or concerns. So whether that's a preoccupation with weight and shape, or I guess an overinvestment in various activities related to the body, perhaps to the detriment of other areas of life. It can also interfere with health and well-being for the individual, which has flow-on effects then for their kind of surroundings and community and society. In contrast, positive body image, probably not surprisingly, is related to the positive kind of evaluations and perceptions of the body and of the appearance. So this often takes the shape of acceptance and appreciation of the body in spite of any perceived flaws. And also kind of attending to the body's needs and recognising the functions of the body rather than just simply what it may or may not look like. Unfortunately, in our current society, and particularly in Western society, there's a high proportion of people who struggle with negative body image, such that it has been also labelled as a normative discontent. So kind of roughly 60 to 80% of people feel dissatisfied with their bodies and are unhappy with the way that they look. As I've kind of mentioned, it can impact on health and well-being. So there's been kind of a few decades now of research on the impact of negative body image, and this kind of ranges across a number of different domains. We can see it in terms of anxiety and depression, in low self-esteem and low confidence, in avoidance, so kind of not wanting to go and do things, so behavioural avoidance, but also avoidance of your own kind of internal experiences and not wanting to experience kind of certain kind of thoughts and feelings. Can lead to unhealthy eating and exercise behaviours, whether that's kind of too much or too little, or a range of different behaviours there. And in some individuals it can lead to more serious eating disorders. So we know, again, from longitudinal research that body dissatisfaction or concerns around weight and shape are one of the most consistent predictors of eating disorders and of disordered eating kind of later in development. So that's where my particular interest area is research-wise, is looking at how body image relates to eating disorders, and then one step further, particularly interested in the prevention side of eating disorders. But again, for those of you who may not be so familiar, eating disorders are, I guess, a range of disorders characterised by disturbance to eating behaviours. So this can be dietary restrictions, so severely restricting how much food someone's taking in. Conversely, binge eating, and then also a range of different compensatory behaviours. So after somebody has eaten or engaged in a binge episode, they might engage in vomiting or excessive exercise or some other behaviour that is an attempt to curtail the effects of the eating. So they're a serious disorder. We know that roughly 8 to 15% of women will suffer an eating disorder across their lifetime. So it's not an insignificant problem. The prevalence rates for males are not so well researched, but again, it is also a problem for males. Perhaps is more known as a female problem. We also know from research that there's an onset peak in adolescence, so kind of coinciding that transition phase through development, both kind of entering adolescence, but then also in late adolescence as they kind of enter into young adulthood. They have a range of serious mental and physical consequences, particularly kind of health-wise for those people who are engaging in very dangerous behaviours, and also has one of the highest mortality risks for any of the psychiatric disorders. So it's a really important problem to try and fix, I guess, if you like, and particularly for me, my interest has always been in prevention. So can we really get to these people, before perhaps some of these behaviours and thought patterns have become really entrenched, and see what we can actually do to ameliorate some of those concerns. In terms of how we go about preventing eating disorders, it's probably not really rocket science. I guess the first step, we need to really understand how we get to an eating disorder. So identifying the risk factors and understanding how they work together to produce disordered eating. And then to develop strategies that kind of map onto those risk factors, that kind of really target and to try and intervene at a point before we have some of those thoughts and behaviours really setting in. Of course, doing is not as easy as saying sometimes, but we're on the track. One of the more well-known models in terms of putting together the risk factors is known as the dual pathway model. So this was developed by Eric Stice in the United States after a number of longitudinal studies, mostly with females. But basically this model describes a pathway to disordered eating behaviours, starting from the pressures to be thin that kind of exist in our society and around kind of family and peers and the media, and the extent to which an individual kind of internalises those kind of cultural ideals. Those aspects then can lead to body dissatisfaction due to the kind of the discrepancy between the ideal and the actual, or how they perceive the actual. So it can lead to negative thoughts and feelings about the self and the kind of feeling of inadequacy and dissatisfaction with how they're looking, which in some individuals can lead to a range of kind of thoughts and behaviours such as dieting, and a range of kind of negative affective experiences, so whether that's depression, anxiety, low self-esteem. And those kind of work together then to eventually produce eating disorder symptoms. Obviously it's not in every single case, but this kind of, I guess, effectively captures a general kind of pathway from go to woke. So I guess kind of based on that understanding of those risk factors, a number of different kind of intervention approaches have been developed. We've been kind of aimed at, just kind of put that back up again there, aimed at intervening at various points along this pathway. I guess one of the most well-known intervention approaches is based on inducing cognitive dissonance. And this is really targeted at this kind of early kind of phase in the development. So getting people to argue against the thin ideal and those cultural kind of pressures, and really kind of, getting some kind of counter-attitudinal experiences happening. is supposedly supposed to lead to kind of cognitive dissonance, which then reduces their internalization of those ideals. So that's been one of the most effective approaches in recent years. However, some kind of meta-analysis has been done, kind of shows that, even though we've got a number of different approaches and programs now, there is still room for improvement. And particularly when we're trying to target some of these later kind of risk factors, the ones that are a bit more kind of proximal to the actual eating disorder behaviour. So that's where mindfulness steps in, where it's conceptualised, which I'll go through in a moment. But before I do, how many people here are actually familiar with what mindfulness is or have practiced mindfulness? A few people? Yep. Most people these days, I find, have at least heard of the word, but kind of varying understanding of what it actually is. So I guess in a real kind of nutshell, mindfulness refers to the non-judgmental awareness and acceptance of a person's experience as it unfolds on a moment-to-moment basis. So it's kind of practicing simply being able to kind of acknowledge it and observe your experience, so without reacting to it, without judging it, without attempting to control it or change it or fix it in any way. So it's very much a case of being able to take a step back from the flow of your own kind of consciousness and your own experiences. And it's said that this enables, a bit of distance, a bit of space to actually be able to welcome all kinds of experiences, kind of both good and both bad. And it enables a bit more control and flexibility then over subsequent actions and behaviours. So rather than kind of diving into automatic kind of patterns and kind of courses of action, it enables somebody to really kind of maintain an awareness on what's important for them right now in that moment, and have a bit more flexibility, I guess, of what they do with that. So some of the key concepts that are emphasised in the practice of mindfulness would be taking a non-striving stance. So the idea with mindfulness is that you're really not trying to achieve anything in particular. You're simply acting as an observer to your own awareness, to your own experience, and maintaining a present moment attention. And so for any of you who've actually tried this, it is actually quite hard to do. But it's one of the skills of mindfulness is to kind of continually bring your attention and your awareness back to whatever's going on for you right in that moment. And then really key concepts of non-judgment and acceptance. So being able to practice mindfulness is being able to observe your experience, so whether it's your thoughts and feelings or whatever you might be doing in that moment, without constantly evaluating whether it's good or bad or true, and being able to accept it as it is in that moment, and then allowing it to kind of move on and readying yourself for whatever the next moment might hold. So that's kind of a brief overview of mindfulness in general. How might it be useful for body image and eating disorders? Well, I guess because of its role in terms of being a metacognitive skill, so being able to kind of step back and view your thoughts and feelings in a slightly different way, acceptance and mindfulness has been said to alter the relationship with negative experiences. So this is really important for body image, which is really characterised by a lot of negativity, so a lot of kind of self-critical thoughts and feelings and disgust and dissatisfaction. So it could be really useful at targeting some of those negative experiences and negative emotions related to the body. In terms of how it might do that, there's a number of different kind of possible mechanisms, and this is an area of research which is very much still ongoing. But it could be that it promotes cognitive flexibility in the individual. So as I was kind of mentioning, instead of kind of going into automatic responses or along kind of various biases, there's a reduction in those kinds of responses. So it's a bit more flexibility over how you kind of proceed from any given point, which might help to reduce ruminative thinking and also constant body checking and avoidance, which are often very automatic behaviours in people with body image disturbance. And those kinds of things help to kind of maintain a focus on the body. So it can kind of help to release those and kind of create more choice over, what the person engages in. It also potentially promotes a non-critical view of self, and again, this is kind of a key part of body image disturbance. So mindfulness actually encourages the observance of your full range of experience. So rather than selectively attending to just the negative and constantly criticizing, you're learning to be aware of perhaps the times when the body is doing something good, or you actually feel good about your body. And learning to refrain from judgment as well kind of increases a sense of kind of kindness and self-compassion, which can be really useful. A third possible mechanism, which I'll just mention, is that it may reduce some kind of fear and anxiety responses simply through exposure. So again, often people with body image disturbance, and particularly those on the more severe end, kind of eating disorder behaviours, often have a lot of kind of fear and anxiety around their appearance. So whether that's, a kind of behavioural, when they're kind of faced with, other people kind of evaluating them, but also fear around their own kind of emotional experiences, and that's something that can present, a kind of a big stumbling block. So again, the practice of mindfulness, which actually teaches a constant observation of these kinds of things, can actually be really useful for people who are used to avoiding them, which can lead to, kind of unhealthy automatic responses. So instead of that, they learn that perhaps it's not so bad. And so, just as part of being human, you can have bad thoughts from time to time, and it doesn't necessarily have to lead you off into a kind of downward spiral. So that kind of sense of being constantly exposed to some of these things can be a really useful learning experience for some people. So I guess in terms of coming back to the dual pathway perspective, we would expect that engaging in mindfulness with respect to kind of thoughts and feelings and experiences related to the body would help to reduce any automatic responses to triggers relating to kind of wanting to be thin or pressures to be thin. So whether that's kind of media or family pressures, or even kind of coming internally. But then also at the same time reducing the impact of any experiences when they do happen. So as I mentioned, kind of being human, we're going to naturally have, bad thoughts about ourselves at one point or another. But it just helps kind of, reduce the ongoing impact that they might have. So I'd like to spend the rest of the time just kind of walking you through some experiments that I've done in terms of evaluating this as an approach. So the first step was just a very kind of preliminary experiment, which was evaluating a very brief kind of mindfulness technique. So for this, I engaged with first-year psychology students, as we all do, and I asked them to undergo a body dissatisfaction induction procedure, where they viewed a set of magazine advertisements, kind of depicting very kind of thin, idealised images. And then some were allocated to receive training in this kind of mindfulness technique. They watched a 10-minute video for that. And then others were asked to simply do nothing. So then those that received the video were then asked to actually practice that, kind of engage with that technique as much as they could for a 5-minute period. And throughout we measured them on weight and appearance satisfaction, and as well negative affect, in terms of getting state measures of those elements. So it was actually really encouraging. We found that those who received the training did experience improvements on weight and appearance satisfaction, and as well on their negative affect. We also noted that those who had emotion-related difficulties, so those who were more likely to have high depression and anxiety, and those who perhaps didn't have quite so adaptive emotional regulation skills, they were less likely to actually engage in the technique in an optimal way. So it was harder to say whether they were actually doing mindfulness or not. However, they still, it didn't prevent them from receiving any benefit. So it's important to see how this actually went in over kind of a long term, to see if those people could still get benefit. but also really important to obviously assess whether this strategy could be useful for people who are already starting off at a point where they had body image concerns. So the next step was developing that kind of brief technique out into a more comprehensive intervention approach. So the program that I developed was a 3-session program, so 1 hour a week over 3 weeks. The first session was really about introducing mindfulness as a way of kind of managing experiences related to our bodies, and introducing the idea of maintaining present moment awareness. The second session was then more focused on the kind of the cognitive element of mindfulness and how we can learn to relate to our thoughts and feelings differently. So stepping back from them and perhaps recognizing that they're just mental events that come and go and don't necessarily need to be acted upon. And then the third session, bring these kind of things together and then kind of emphasize the non-judgmental aspect of mindfulness. So helping to refrain from self-criticism and really engaging kind of acceptance towards the self and self-compassion. So the idea was to evaluate this program in a randomized control trial, and given that we know that there's a high risk period in both early and late adolescence, we decided to go with late adolescents this time around for the first group, and we wanted to compare it against something that we knew worked. So as I mentioned before, cognitive dissonance has been the kind of the leading strategy over the past decade. So we compared 3 interventions: the mindfulness intervention, the cognitive dissonance intervention, and then we had a no intervention control. These were all young women who met a criteria cut off for having body image concerns, so we knew that this is something that could potentially be useful if it worked. And the intervention was delivered in a small group kind of setting, so kind of 2 to 4 participants in each group. So they were able to kind of engage and interact with each other. And then we assessed before and after the intervention again at 1 and 6 months. So in terms of our primary outcome, weight and shape concerns, you'll kind of see there that there was a really encouraging sign that we did get an improvement for those engaging in the mindfulness program after the intervention. However, as you can see, this wasn't really maintained over the 1 month, 6 month follow-up periods. So it seems like, you know, it can be effective, but there's some work to be done in terms of trying to maintain those effects. I'm not going to go into the kind of the other risk factors, but basically we measured all the risk factors in the dual pathway model, and they generally showed the same pattern, with having an improvement to post, but then kind of dropping off and not being evident later on. So we thought this was encouraging, but also wanted to see how it might go in a slightly younger age group, and also kind of changing up the way we deliver the program. So a lot of eating disorder prevention programs are delivered in schools. We thought it was important to kind of see how it might go in that setting as well. So for this, took 345 senior high school students in Australia. Very similar experimental design with the same 3 conditions. Adapted the program slightly because it was being delivered to whole class groups. So basically kind of 25 students instead of 2 to 4. And given that it was kind of whole classroom, we had a range of kind of body image concerns from kind of low risk to high risk. And again, followed up over 6 months. So again, here on weight concerns, you can see it's a slightly different pattern to what we saw with the young adult women. There wasn't quite a noticeable improvement initially, but it was significantly different from control over the whole kind of follow-up period. So a lot more low grade. The important thing to point out was that this was the only variable that had a significant effect on. So even though the program in young adults seemed to have an effect on a number of different areas, we didn't see that happening with our high school students. So I guess kind of concluding from that it was kind of a lot less effective in that kind of setting and in that age group.
Can I ask what level of production would you consider to be fit?
In terms of the kind of weight and shape concerns, yeah. So I guess it's probably something I should mention as well. We used a slightly different measure in the young adults to the high school group. So in the young adults, we used a measure which does have kind of clinical cutoffs. In the high school group, we used a very short kind of 5-item measure. So in terms of saying what is, kind of a importance is a lot harder to say with that measure. But I would suggest that we weren't seeing improvements that would be noticeable, I guess. The other thing you might notice there is that the dissonance group actually did better than the control group, although it wasn't significant difference. So, yeah, make of that what you will. So, I guess, kind of putting those studies together, we did find it encouraging that we did have some kind of significant effects for mindfulness, given that it's something that's never been studied in this context before. It seemed to do better with the kind of young adults and in a small group setting, although we need some work to kind of maintain those effects. And there also needs to be some work if it's going to be considered as an intervention approach in a school setting. So I think it's really important to do more research, understanding the mechanisms, because that will enable us to really kind of target and be more specific in our intervention approaches. Also really encouraging the ongoing use of mindfulness in terms of trying to maintain those effects. So mindfulness definitely seems to be something that you practice as a skill and you get better with over time. And then also, obviously kind of trying to kind of adapt the intervention and delivery perhaps to try and engage a younger audience in that setting. So I think that's about all I had planned, so hopefully it's been interesting. If you've got any questions, feel free to ask. Otherwise, I'll hand it back to